Bulletproof Radio, a state of high performance.
There's some other things that happen if you overfast, or if you just are going through aging in women. Low libido. Talk to me about why that happens.
So many reasons. So low libido is multifactorial. I tell people, imagine walking into a cockpit of a plane and looking at all those buttons and dials. So it can be relationship. If you don't like your partner or you're not attracted to your partner, that has a lot to do with it. Neurochemistry. If we have too many inhibitory signals in our brain and not enough excitatory signals. Hormones. As we age, our ovaries produce less and less testosterone. There was a consensus statement 2 years ago that testosterone is key and vital for women in all the domains of sexuality. Our lifestyle. You're working third shift, he's working second shift, you have young babies in the bed, medications, illness, stress. You're stressed about money, you're stressed about the pandemic. There are so many things that can interfere with sexuality. And the truth is that 1 out of every 10 women struggle with something called HSDD, right? We changed impotence to erectile dysfunction. We call low libido, which I feel like blames women, hypoactive sexual desire disorder. And 1 out of every 10 women suffer from it at some point in their lifetime. And we have to decide, when they need treatment. And as of 2015, there were 0 treatments on the market, none for women. And now we have 2 that are FDA approved, and then we have a few that are off-label treatments, right? Meaning they're indicated for something else, but there's FSFI data, female sexual function index data, proving that libido does increase if you prescribe these medications.
And these are, they've stopped naming medications that you can pronounce. Adyi, A-D-D-Y-I, and Vyleesi. Who names these things? So I can say Vyleesi. Adyi? What is that? Addy. Is that how you say it? All right.
Addy.
So
yeah,
I have never experienced the effects of these drugs because Lana doesn't use them. What are they? How do they work?
So they work on different neurotransmitters in the brain, and basically they increase excitatory signals and decrease inhibitory signals. And they did a fascinating study where they took women who were struggling with HSDD, women who weren't, showed them erotica, i.e. porn, and then put them in MRI machines and watched the neurochemistry. And what they saw with women who were struggling with HSDD is the parts of their brain that say, yes, I want to have sex, or yes, I'm going to eat that cake, were very quiet. And the parts of their brain that told them no were very active. And the opposite pattern in women who weren't struggling with their libido. And so, so these medications work on neurochemistry, and they're non-hormonal, which is really nice for patients who can't have hormones. Addy is every night, regardless of whether or not you want to have sex. So it is not the female Viagra. It's not on demand. Vyleesi is an injection given at least 45 minutes before you want to have sex. And it is on demand. So they both work, differently.
Can you take them together?
No, that's
okay. It's one or the other.
Yeah, it's one or the other. And then I oftentimes will add testosterone depending, but the side effects are both different. Some are contraindicated for certain patients, but basically Addy met clinical guideline or endpoints as far as increased number of sexually satisfying events. So no more checking a box sex or keeping the peace sex in the marriage, decreased distress about your sexuality and increased desire. So that's really, really nice. And some of my patients who are like, Dr. Javaid, you have to fix this now. Addy can take 6 to 8 weeks to work. No, I'm serious. They'll come in and be like, listen, I'm having a save the marriage weekend. And we're like, okay, well then I can't give you this medication because it'll take too long. And so I'll prescribe Vyleesi because that works immediately. Both drugs have side effects. Both drugs have non-responders. It's just setting expectations for patients. But it's a travesty because Addy took 6 years to get FDA approved. Viagra took 6 months. Men have 26 options, women have 2. And so it's been an interesting journey with the FDA and to even get solutions out there that, you can prescribe for patients.